We've been looking at it from a medical point of view since the very beginning. It's very important to get to grips with what a coronavirus actually is and what is needed to get it under control. 7 months later, do you feel we're looking at it from from enough different perspectives? For example, social sciences, humanities, do they have a role to play, you feel, in how we deal with corona, or is it legitimate for them to take a step back and for medical specialists, economical specialists to take the fore?
Well, I think the social scientists and humanities definitely have a role to play, not only now, but from the very, very beginning. As I said, just seeing that the most vulnerable or the first victims, not only on the economic level, but also when you see the effects of lockdown measures, for example, on education of children, on domestic violence. These are all fields that have to be put forward in the public debate, have to be put under the attention of policymakers, where I think that actually scientists, researchers, and civil society can really work together to put forward the problem and possible solutions. And the focus on the health aspect is, for some countries outside Europe, not really the first problem. It has been said often, some people have to choose between the risk of having corona or the risk of having hunger. And it's like a really difficult problem for those people. You cannot say, I save you from corona, but sorry, you will have to starve from hunger. So the income problems are much heavier in many countries than the actual health problems. So that's one of the issues, I think, that also social scientists, but also within Belgium, can think how to cope with that and how to keep it on the agenda, especially what is the price of fighting the pandemic and for whom.
70% of social media influencers from specific diverse communities in Brussels do not want to support the case of getting people to adhere to the COVID-19 guidelines. Of course, you can put out all the information and all the scientific studies that you want. Not everyone will read them, to put it lightly, will think about them, will form their own judgment about them. So what do you do, or can one do, with regard to this lack of motivation or the needs of information of specific communities? Do you need one-on-one contacts to get everyone on board? What's the answer?
I think that there's just one thing I want to stress is, again, we're not all in the same position in this crisis. So when it comes to motivation to respect rules and legitimacy of rules, we're not in the same situation. I remember in the first lockdown, some people were telling me during Zoom meetings, like, this is really an opportunity for us to think and appreciate small things in life. Well, as a single mother with 2 children working double as normal, I was like, no, this is not the same. And still, relatively, I can also relate to other people who are in a worse situation, who are maybe living with 5 in a small apartment, who cannot go outside, who have to take care of their parents because there's no alternative, etc., etc. So I think rather than the focus that we have had often, unfortunately, on why certain communities don't want to respect or don't understand the rules, we have to really, really take more into account the different situations people have and how we can have answers to the real challenges they are facing and take that into account. It is not the same to respect a lockdown in a villa with a garden than in an apartment with a lot of children who have to also follow school, who don't even have a connection, etc. Looking
back on all that we discussed, is it a matter of reorganizing society in economical terms? That's what I want to focus on now, to really change things that are perceived as wrong right now? Or is it more a matter of thinking how we think about what it is to be human that needs to be done? Is it a philosophical approach that needs to be taken, or is it all about the hardwire of society, and is a revolution needed? Let me put it that way.
as they say, never waste a good crisis. So a crisis is a crisis, and we should not make a romantic picture of it. But a crisis always is an opportunity as well. And I think this crisis has opportunities to recognize the impact of the climate crisis, the crisis of biodiversity as a cause of the pandemic, to recognize the importance of social services, of health workers, to recognize the importance of public services, like the state now intervening to ensure for people a decent life, even when they are hit by the economic consequences of the measures and the crisis. The importance of women working much more than men in those social services, people with migrant background as well. So I think it is an opportunity, but of course it's not going to realize it itself. And that's where, again, I also turn to researchers to tell us what makes that a crisis is not wasted or wasted historically. What lessons can we learn? And to continue, that's really the call I would like to finish with, to continue to nourish the public debates, to nourish also civil society organizations, because our core business is to work towards social impact in society, impact in policy making. And often I'm really struck how much there is known in academic worlds that we don't know. We have no clue. So please let us know all these important information, this trend. Invest some of your time in making fact sheets, in making publishing in mainstream media, because it helps us as well to try to push in the good direction so that this crisis is not wasted.
Let me then address Maarten van Steenkiste, one of the social scientists here. Good afternoon to you too. Let's tie in with what Naima just said. Where do you see the role of the social scientists? Was I right in saying you had to really fight for a seat at the table, for the right to be heard and to be taken seriously in how to deal with this coronavirus, and to convince policymakers of your contribution and the value of it?
Yes, I think that was a very correct description. It also felt like a little bit as battling to be heard, to have your voice out there. And I think from a psychological perspective, we have a lot to add there already, as said also before, from the very beginning. And I think in two different ways, because basically what is critical here is our behavior, because it's our behavior that is indeed, that comes before the number of infections, that becomes before the number of people hospitalized and the number of death. So it's really by changing our behavior, adapting our behavior and following the corona rules that we can have all an impact. And so then the question is, what is driving our behavior? What are the motives for people to adhere to the measures or to not adhere, to defy them? So that from that perspective, we need to develop a set of measures that are motivationally supported, that are well communicated. So that's, I think, one important area where psychologists or behavioral psychologists and health psychologists could add. Mm-hmm. And then a second area, I think, is indeed the mental health. Lots of people are suffering from the current crisis in one way or another. Social relations get disrupted. It's harder to keep up with friends. Some people feel more lonely. And it's true that some people are hit more by the current crisis than others. So there's some inequality there. And I think from a clinical psychological perspective, well, we could develop more mental health programs, for instance, bring it out, launch it there, so to support people and also to react in resilient ways to cope with the situation. So I think these are the two primary areas where we could contribute as psychologists.
This virus is intangible. It's not there for us to see or to touch. We can see the effects, and we can see it when we watch the news, or we know someone or friends or family or neighbors. But of course, mutatis mutandis, this applies also to climate change, for example. Do you think, Professor van Steenkiste, that what you and your colleagues are now learning about our behavior and how to nudge it, manipulate it, that sounds too negative, I know, but how to steer it might help to also deal better with the climate change challenge that is ahead, or is that too optimistic?
Well, I think we can definitely learn from this crisis how we have handled it. I think, and there are parallels in, let's say, in both cases. It's a matter of adherence to the corona measures, adherence to ecologically friendly behavior. And in both cases, we see people who may initially engage in it and then not follow up with it or not continue with it. And so I think what we learn also here is that, and that relates also to your question you had earlier on, it's of course those politicians were making decisions based also on their experiences in their lives. But I would have hoped, truthfully, that they would have turned much more to data, to evidence-based advice. And we have multidisciplinary teams, we have fantastic universities and people who are doing terrific work. But I would think that in a policy position, you do turn to those sources. And I haven't seen that enough, which is, I think.
Why don't they? Why is the discipline, our social sciences in general, not taken seriously by politicians,
I don't know. I'm not sure whether it's just us, but what I see is a difference with Frank van den Broeke, who has a much more scientific mindset to begin with. I mean, we haven't seen a lot of politicians in the studios. I mean, we haven't seen them to explain their policies. We need to have them there. They need to justify and motivate people. You cannot just say, stay in your cut. You need to be more than that. I mean, it's about developing a coherent framework, which is also what we need for climate change.
Engaged learning, this connection between, indeed, like Naima just said, civil society, feeding them with all the expertise that's there in academia, but also the connection between academia and students that are now being driven back behind their screens, their computer screens. There's no, or much less, contact face-to-face between teachers and students. How to reactivate this engaged learning, and what is the importance of that to pass on expertise, but also maybe the energy and the will to act in the world and affect the change that that is required, or that may be required.
Well, I think at a very structural level in the university, we need to prioritize more this task. I mean, we are asked to do research, to indeed to teach, and then you have societal valorization of your work, where I see a lot of colleagues who don't go out, who stay within the building. It's also, I mean, you need also to some extent other skills to bring out your message. I mean, it's not the same kind of skills as you need for doing good research and teaching. And there's a lot of, I think, still emphasis on who is an excellent researcher, but still there's indeed, as you say, Naima, so much valuable work out there. And maybe we need to value more this part of our jobs. And if that's the case, I think also funding, as Olga said it before, short-term funding may also go more easily to such projects in order then to help society to move things forward in a good direction. So I think this is a discussion which needs to be held also at the level of the university as such.
Olga van Oost, let me come to you now. Our mental health and mental well-being, finding sources of energy and hope and inspiration can be found in the cultural field, of course, your field. And today there was this piece in one of the Belgian newspapers, The Standard, about the hit the museums took or are taking because of Corona. Tell us a bit about that, and where you see the threats and chances of what Corona is causing in your field.
I think this crisis is having a major impact and also on our sector. And maybe when you think about heritage, probably people think about collections and objects. That's heritage work. And that's true. That's what we do, where we care for objects and so on. But that's not the only thing that we do. I think what's very important now is to realize that heritage work is mainly a question of community work. It's really working with people, communities in our museums, archives, heritage libraries, intangible heritage communities, you name it. But it's also working with audiences, with volunteers,
mainly elderly people who are hit really hard, but also working with children and school children, young people, and so on, and vulnerable people. As Naima said, it's also very present in our line of work. And I think what was very disrupting is that, well, due to the lockdown and the crisis altogether, is that all this community work really, it all collapsed from one day to the other also. And well, we have to deal with this because especially all those people, well, who are not connected as more privileged people are, like myself, like you probably, what is going on with these people? And I think, well, that's also one of the major concerns right now in the world, but also in the cultural world and in the cultural heritage world, or it should be one of the major concerns. What are we going to do about this?
Gert Vermeulen, are you as positive as Olga van Oost about getting beyond party politics, getting beyond own interests, special interests, in the search, the quest for the way out?
Annelies, I guess you're focusing now on data protection in particular, probably.
You can, any angle, there are a number that we could be discussing with you. So data protection, yes, please.
What happened in Belgium is that the entire focus in the media and I think in Belgian politics has been around a single approach, the so-called DP3T approach, and I can expand on that later, which focuses on a decentralized keeping of data on individual smartphones without any centralized possibility to do anything with the data at all, so that it's completely irrelevant to feed policymakers and to steer measures. And honestly, I think there's no way in denying that we know nothing but ex post data that we have on the basis of people that have been hospitalized, have been put in intensive care units, people that have been infected. So it's constantly old data. We're extremely, I think, reactive. We're not capable of measuring anything real time, and I'm not speaking about individuals. We have statistical models and mathematical models, but they're totally disconnected from where actually infection happens. At best, we do know where people that have been infected live based on their residence, but it's so painful that we do miss the essential tool that we need for many months since now, and we don't have it. And I think it's a stunning, not stunning, it's a shocking, I think it's shockingly irresponsible of policymakers that they've chosen for a sole avenue, excluding and sort of excluding the possibility to have informed policies. We're closing cafes and restaurants. What figures do we have? Some vague figures based on manual contact tracing. It's honestly so sad, so poor. Yeah, that I think it's ununderstandable, and it's not a matter of party politics. It's not a matter of specific interests. It's very difficult to pinpoint the actual reasons for the tunnel vision that have arisen, but I find it dramatic, and I think it's too late to actually, shift to a different policy. So it simply saddens me. That's it. Even if we've informed the entire policy circle of ministers, cabinet people in the Interfederal Committee for Testing and Tracing, many of them agreeing that we need those data, but none of them actually being capable of moving into a more sensitive area, which is working with geolocation data. But if you do that with all protections in place, all data protection experts are actually very clear that it's possible, perfectly compliant with GDPR. And I think also the citizen could be convinced to have trust in scientific institutions to do the job that they usually do for the public, by which basically we're being paid. So I'm sort of frustrated that we've not been able to do our jobs.
There's a constant cry for, what is it, eenheid van commando, one commander, one commander-in-chief, so to speak.
And
it's a bit contradictory, isn't it?
Because there is no single line of command. There hasn't been a single line of command in many months to start with. I think we would have needed it much more, honestly, and for a shorter term, that would probably have helped also the motivation of people. I think people have quite often felt very differently from policymakers. I think many people, in some instances, did also not comprehend the weakness of the policy. Sometimes the loosening of measure was very counterintuitive for many people. So I think that there's been a disconnection for many months between what the government says and what experts are telling day after day, and which honestly is not very stable. So I think that the public and the audience has lost like connection with the policy world. But turning to your initial point, Annelies, about the legal system, I think that we did have legislations before the crisis in the context of public health, for instance, which allows to come with restraining orders against people who have been infected, etc. So our default legislation actually allows for more draconian measures than the ones that we've taken in the crisis.
So I think this is where we land. Of course, there's much more that can be discussed, but I think a lot has been broached, a lot of food for thought has been produced by the panelists. So I thank you very much, Olga van Oost van Faro, Professor Gert Vermeulen, Naima Sharkawi from LVLV, and Professor Maarten van Steenkiste. I'm sure this is not the last we've seen and heard of you at all. I hope, we all hope, that this has proven useful and inspirational. I hope you all stay well, healthy and happy, and inspired to do the job that you are doing.